sure that the presenters do have a chance to get through their presentations, we will go ahead and get started. Welcome everyone to track 3, breakout session 3. This session is oral presentations on youth and adolescent health. Our first presentation is entitled LGBTQ Health in Chicago Public Schools, Working Toward Equity. Our presenters are Marisa DiPaolo, Surveillance Coordinator for the CPS Office of Student Health and Wellness, Madeline Mangiaracina, Research Assistant, University of Illinois School of Public Health, and Booker Marshall, Sexual Health Project Manager, CPS Office of Student Health and Wellness. After they present, we're going to have a talk on asthma disparities in Illinois, a data-informed approach to health education, which will be presented by Mary Rosenwinkel, Program Coordinator for the Respiratory Health Association. And I am going to turn it over now to Marisa to share her screen.
All right, let me pull this up. Oh, let's see.
I have to say that PowerPoint slide brings back very fond memories for me as a former OSHW employee.
Bringing you back.
Yes.
I love it. Perfect. Okay, so I'll take that as an indicator that everyone can see my screen. So we are going to start our presentation on LGBTQ health in Chicago Public Schools, working towards equity. We'll be sharing the results of some data analysis that Madeline and I conducted about LGBTQ health in CPS. So just some quick acknowledgements. Our presentation was supported by a grant from the CDC, and also we wanted to acknowledge the UIC Policy Practice and Prevention Research Center, which is the evaluator on our CDC grant and supported the research presented here. So just a quick agenda for our presentation today. We will describe the CPS Office of Student Health and Wellness, also known as OSHW. We'll give a brief introduction to the Youth Risk Behavior Survey, also known as YRBS. Then we'll go through some demographic information about LGBTQ+ students in CPS based on the 2019 YRBS data. We'll review the LGBTQ+ health outcomes that we studied. And then we'll talk a bit about what CPS is doing to support LGBTQ+ students in their work right now. And we'll close out with what you can do to support LGBTQ+ youth in Chicago. So the objectives for our presentation today, by the end of this talk, participants will be able to describe the goals of the Office of Student Health and Wellness at CPS. You'll be able to identify health issues, including mental health and substance use that disproportionately affect LGBTQ+ high school students in Chicago. And then you'll be able to identify one action step that you can take to support LGBTQ+ youth in Chicago. So we'll start with the mission and vision of OSHW. The mission of the Office of Student Health and Wellness is to remove health-related barriers to learning and advance health equity in Chicago. And then the vision of OSHW is to create a healthy CPS that serves as a national benchmark for student health and wellness. So the whole child framework is kind of the backdrop for all of the work that we do at OSHW. So it's also called WISC, the whole school, whole community, whole child. It's a framework for addressing mental, physical, and social emotional health in schools. And a key part of this framework is that it is a student-centered approach to addressing health and wellness. So you can see in the diagram that there is a student right in the middle, and then the community on the outside. So focusing on student-centered ways to address health and wellness issues in schools. And it was created by the CDC and ASCD. So that's kind of the backdrop for all of our work. And then this is a pretty big overview of all the different components of the Office of Student Health and Wellness. We have a number of different departments that we work closely with: health promotion, health information, student health services, children and family benefits, which is about getting families connected to Medicaid and SNAP. The COVID response falls under our office, as well as nursing and CPS. So our team that we represent here today is the health promotion team. The health promotion team works on sexual health education in the district, LGBTQ+ student supports, school gardens programming, nutrition education, school food promotion, recess, and WISC also falls under health promotion. So then I'll turn it over to my co-presenter Madeline to talk a bit about the background of the 2019 YRBS.
Thank you, Marisa. So a brief introduction to the YRBS dataset, which we used in our analysis for this research. The Youth Risk Behavior Surveillance Survey, or YRBSS, monitors youth behaviors and outcomes over time. CPS conducts separate middle and high school surveys, but the analysis presented today focuses only on high school surveys. And the Chicago YRBS, conducted in 2019, collected a representative sample of all students attending public high schools, and this excludes charter schools and alternative schools. And this is also district level data, so the data cannot be further broken down by geographic area. We would also like to note that that weighted data was used in our analysis to ensure a representative sample. So we would also like to note that all the information discussed in this presentation can be found in our published data report titled LGBTQ Health in Chicago Public Schools Working Towards Equity, which will be available on the CPS public-facing website next week. More detailed information about our data analysis methods is also included in that data report, and we will be sharing that data report with you at the end of this presentation. So the two questions from the YRBS that were used for our analysis, the questions related to gender identity and sexual identity. The question related to gender identity in the YRBS survey asked students, are you transgender? With the options of no, I am not transgender, yes, I am transgender, I'm not sure if I am transgender, or I do not know what this question is asking. The question related to sexual identity asked students, how do you describe yourself? Either heterosexual or straight, lesbian or gay, bisexual, or unsure. 2019 was the first year that Chicago YRBS collected data on transgender identities. And it's also important to note that the way these questions are worded in the survey is not inclusive of all gender identities and sexual orientations. This is language that is used in the CDC's standardized YRBS questions. And these standardized questions are used to compare results to the national YRBS results and other state and local YRBS surveys in order to track trends over time.
Great, thanks, Madeline. So now we'll talk a little bit about LGBTQ demographics as we found from the 2019 YRBS data. So in order to conduct our health outcomes analysis, we created two different variables, the first of which is the LGBT variable, using those two questions that Madeline just described. So if students responded that they were lesbian, gay, or bisexual in the sexual identity question, or that they were transgender in the gender identity question, then we grouped them into the LGBT group. And we found that 16.51% of CPS high school students identify as LGBT. And then we also created the LGBTQ variable. So in this case, we combined all of the responses from the LGBT variable. So anyone who responded that they were lesbian, gay, or bisexual, or transgender. And then we also included students who said that they were unsure or questioning either their sexual identity or their gender identity. So overall, we found that 22.74% of CPS high school students are LGBTQ. So what does that actually look like in practice? That's about a quarter of students almost. So visually, to represent that, we have this image here showing that in a CPS high school classroom of 28 students, on average, about 6 would identify as lesbian, gay, bisexual, transgender, or questioning. And this percentage is often higher than people expect it to be. And we just want people to know that even if they don't know that there are LGBTQ students in their school or their classroom, we know that they're there based on this data, and there are a lot of them.
All right, so now we're gonna take a look at some of the results of our analysis. And we would also like to give a quick content warning before we dive into the results. It's impossible to talk about addressing LGBTQ health and equity without first talking about the adverse experiences that LGBT youth are facing related to mental health, violence, victimization, and safety at school. So the next section of our slides in this presentation does contain data on adverse health outcomes and experiences faced by CPS high school students. And this content may be alarming to some viewers, so we want to make a disclosure about that. We will be sharing data on health disparities related to topics of depression, suicidality, suicide attempts, substance use, school safety, and bullying. So our YRBS analysis revealed that many LGBT high school students in CPS lack a safe environment in their schools. They face disproportionate rates of bullying and missing school more frequently due to feeling unsafe. This graph here, the orange line represents LGBT students and the dark blue lines represent non-LGBT students. And we found nearly a quarter of LGBT students missed school in the past 30 days because they did not feel safe at school or did not feel safe on their way to or from school. We also found that LGBT students are more significantly likely to have carried a weapon on school property, to have been bullied both at school or online, or to have been in a physical fight at school. And all of the differences shown in this graph were statistically significant based on chi-score testing. So after we ran multivariate regression and controlled for demographics, which included age, sex, race, and ethnicity, we found LGBT high school students were nearly 2.5 times more likely to have missed school due to feeling unsafe in the past 30 days compared to their non-LGBT peers. We found that they were over 6 times more likely to have carried a weapon on school property in the past 30 days, approximately 2 times as likely to have been bullied on school property in the past 12 months, and to have gotten in a physical fight on school property in the past 12 months compared to their non-LGBT peers. We also found that LGBT students in CPS high schools are also facing alarming rates of adverse mental health experiences. We found that 60% of LGBT students experienced symptoms of depression that lasted at least 2 weeks in a row over the past 12 months, compared to 34% of non-LGBT identified youth. These numbers are, of course, far too high for both of these groups, but we did find that nearly 2/3 of LGBT youth are experiencing symptoms of depression. And in addition, more than 1/3 of LGBT youth had seriously considered suicide in the past year, and 22% had actually attempted a suicide attempt in the past year. And as this graph reveals, these numbers are also disproportionately high for LGBT youth. So after controlling for those demographics again, we found that LGBT high school students were nearly 3 times as likely to have experienced symptoms of depression in the past 12 months, over 3 times more likely to report that they had seriously considered suicide in the past 12 months, and 3 times more likely to have reported they attempted suicide in the past 12 months compared to their non-LGBT peers. In addition, we found LGBT students in CPS high schools to face additionally alarming rates of substance use, including use of marijuana, alcohol, other drugs, heroin, and misusing prescription pain medications. We noticed the disparity was significantly high for heroin use, as well as having misused prescription pain medications among LGBT high school students. And after we controlled for those demographics again, we found that LGBT high school students in CPS were nearly 2.5 times more likely to have ever used marijuana, nearly 2 times more likely to have ever used alcohol, nearly 3 times more likely to have ever used other drugs, which excludes marijuana, over 3 times more likely to have misused prescription pain medications. And we also found LGBT high school CPS students to be nearly 10 times more likely to have ever used heroin compared to their non-LGBT peers. So that was a lot of really alarming data results that we shared with you. We want to just take a moment for all of us to just pause, take a deep breath before Marisa takes us to our next slides, which we'll discuss what we can do to address these disparities. So we'll just take a deep breath together.
All right, thank you so much, Madeline. Okay, so we are going to move forward to talking about where we can go from here now that we know so much about what LGBTQ youth are facing in CPS schools. What do we do? So first I wanted to go through just a few things that CPS is doing to address LGBTQ+ health in the district. This is not by any means a comprehensive list, but you can find actually more of this information in our data report, which I believe Madeline is going to drop in the chat for y'all soon. And so this report is newly available publicly, so that'll be on the website, the public-facing website, in about a week, hopefully. But y'all will have it when you leave today if you want to be able to check out more details about the analysis we just presented. So the LGBTQ health report is one thing that we've accomplished in order to address some of this. And then importantly, in the CPS 5-year vision, one of the goals is to have a Gender and Sexuality Alliance, or a GSA, in every school in the district by 2024. And the Office of Student Health and Wellness is working on helping school staff to make this happen, offering GSA advisors training, as well as additional staff training and support that the Office of Student Health and Wellness offers. There are trainings available for school staff about supporting LGBTQ youth in schools, safe and supportive environments trainings, and there is a new webinar about supporting transgender, non-binary, and gender non-conforming youth that will be required of all CPS school staff this year. So that's new this year. And then LGBTQ plus inclusive curricula is also being expanded in the district right now. There's a new law in Illinois that all schools need to teach LGBTQ inclusive history education. So our office is also collaborating with the Office of Teaching and Learning on building out that curriculum. And then the sexual health education curriculum, which is required in all CPS schools that CPS provides to teachers, is inclusive of LGBTQ youth. And additionally, our office is also working on new initiatives around caregiver engagement. There are some resources for parents about supporting LGBTQ youth that are now available on the CPS website, just to give you a sampling of things that are happening. So now I want everyone to take a quick 30-second pause and really think about what one thing you can do to support LGBTQ plus youth in Chicago is, whether that's in your professional role, in your personal life. Think just for 30 seconds about what one actionable step you can take to support LGBTQ youth might be. So I'll just pause to let everyone think about that. Okay, so now I do have some ideas to share with y'all. If you had trouble thinking of something, or if you want some more ideas to add to your toolkit, we have them broken down by different types of people who might be in the audience. So for people who work at CPS schools, a few things that you can do to support LGBTQ youth are, importantly, to support your school's GSA or start one yourself. We know that these have a profound impact on LGBTQ youth health. So getting involved with your school's GSA is one way that you could support LGBTQ youth. Attending a training that our office offers is another great way to learn a little bit and practice supporting youth in your schools. And then wearing an Out for Safe Schools badge, if you don't have one already, that's something you can contact us about. And we can get you connected with that so that you can show off your support as an ally to LGBTQ students as well. For folks who work in community organizations, there might be opportunities for you to collaborate with OSHW or with the CPS school directly on initiatives to support LGBTQ plus youth. And then also you can share the data and information that you learned about in today's presentation, or the LGBTQ health report that we'll share with y'all about LGBTQ plus youth health and wellness with your networks, and encourage everyone to think about this in the work that they do. And then finally, for everyone, educating yourself on LGBTQ plus inclusive language and calling out homophobia and transphobia wherever you see it. These are certainly things we can all do. Volunteering at an organization that supports LGBTQ plus youth, or make a donation to the Children First Fund to support all CPS students. These are just a few ideas. And we do have just a couple minutes left, so if anyone wants to share out in the chat what their idea was for their action step, we would definitely love to hear it. And I will leave y'all with our contact information. So Booker is my supervisor in the Office of Student Health and Wellness. They're our sexual health project manager, and hopefully they can help answer any questions that you have about any of this work. My email is there as well. And then our OSHW email and contact information is also available to everyone.
Thank you so much to the wonderful presentation from CPS. We are going to save questions until the end, so we'll have Mary cue up her presentation now.
All right. 1 second. Sorry, give me 1 second. All right. Everyone able to see that? Okay. Cool, thank you. Well, my name is Mary Rosenwinkel. I am a program coordinator at Respiratory Health Association. We are a lung health organization that is working in Chicago, and I specifically oversee our asthma education programs. So today I'm going to talk a little bit more about this past 2019-2020 school year, where we were able to do some asthma education throughout the state and expand our program a little bit through a grant that we worked under. So I'm going to be talking a little bit about the asthma disparities that we see in the state and really our approach to health education and prioritizing where exactly we did that education. All right, so childhood asthma in Illinois remains to be a leading cause of school absenteeism. So over 300,000 missed school days a year. So I think that is overseen a lot, but asthma remains to be a very uncontrolled chronic disease for young people. Only 1 in 4 children with asthma have their disease under control. So a lot of times how we think about that is 3 out of 4 students are experiencing symptoms at school in the classroom. And we see that these disparities are all throughout Illinois. So that map on the right-hand side is Illinois and the asthma-related ED visits for youth in Illinois. So we can see that there's asthma ED visits everywhere, but obviously there are areas that are affected more than others. So we took a look at EMS visits for asthma-related emergencies from the Illinois Department of Public Health mostly, and these data really guided us when we looked at, what priority areas do we want to focus our asthma education in. Where can we maximize our resources so that we are able to, reach students who are disproportionately affected by not only asthma prevalence, but also, ED visits and uncontrolled asthma. And, with a lot of health disparities, people are affected, we see people who are affected disproportionately with other health outcomes too. It's not just asthma. So most of these areas that have those high rates are also affected by other health things and also are low-income areas. So just a little bit more about this program that I've been describing. The Fight Asthma Now program teaches students how to appropriately self-manage their asthma. So it's a 3-day program where we go over respiratory system, common asthma warning signs and triggers, trigger avoidance strategies, proper medication technique, and asthma emergency responses. So with the grant that we received from the Illinois State Board of Education, we were in charge of delivering our Fight Asthma Now program to at least 1,000 students. That was our original goal. And traditionally, our programs have only stayed in the Chicagoland area, but this was a really great opportunity for us to actually expand our reach outside of just CPS and really reach those target areas throughout the state. Again, those communities and those counties that have been disproportionately affected, who may not have had our education or any asthma education prior to us coming in. So we did specific targeted outreach to elementary and middle schools in those high need counties, again, which were informed by the data that we received from IDPH, including EMS visits and ED visits. All programs were, or all, counties in Illinois were eligible for our programs, but again, we really tried to target our resources and maximize our resources so that we were able to reach students who had uncontrolled asthma. So here's a map of where we are, where we have been this past school year, and this is also through December of 2020. So as you can see, we reached over 1,200 students in the past school year through 70 schools in 8 different counties. And again, we're not done yet. So you know, that's a big reach considering the CPS strike earlier last year and also the school closures due to COVID-19. So again, here's just a visual. All these, each single red dot represents schools that we were in. A part of our program also is a pre and a post survey that every student completes at the beginning and the end of the program. These questions were able to assess knowledge, practices, and attitudes before and after the program. So I'll show a picture of some of those questions, but we were able to partner with the University of Chicago to look at that data and evaluate the outcomes of our program. Using the data that we received from the FAN program. So here's just a picture of the survey. Each question was split up into yes, no, or I don't know answers. And that is how this data is what we used to analyze outcomes. So I'm just going to go over some of the preliminary results. We have a lot of data from the work that UCM has done, but I just wanted to pull some highlights from it. So here is the overall mean knowledge score of the program. And this is the average of 11 questions on the pre and post survey that, that represented knowledge gain. So we can see here that students are learning from this program based off of the post-survey data, which is great. It's telling us that this program is beneficial, that the curriculum is effective. And then we were able to take a look at some outcomes based off of prior FAN attendance. So we were able to pull some of these numbers and compare our data based off students who have come to the FAN program before and ones who have not. So again, we see for both of these groups on the left-hand side, those are first-time attendees. They've never attended our program. We see that there is, that students are learning from this program. It is beneficial. And then on the right-hand side, we also see repeat attendees, that there is, there's also still knowledge gain or growth in that way too. So that was really encouraging also for us to see that no matter if they had been to the program for the first time or if they have received our program for the past, 4 years, the program is still effective and students are still learning things. And here's just some outcomes by region. So we were able to split this up through the city of Chicago. So think about all CPS students. Cook County, so suburban Cook and the surrounding areas on the outskirts of Chicago. And then the rest of Illinois there on the right-hand side. So again, across the board, we're seeing that students are learning from this program. And yeah, these are really encouraging results. So just a couple of key findings from this project. It is really clear to us that there are disparities in childhood asthma across Illinois, not just Chicago. We see that these disparities kind of spread throughout the state, central and southern Illinois in particular. This approach that we took to address the health disparities was really allowed us to provide some education to students who have never had this education before. They're high need students. And, you know, high need in the terms of some of these young people have very unmanaged asthma and are, you know, reaching the emergency department because of uncontrolled asthma. And so we see that providing this education was really beneficial. Not only was the knowledge gain significantly increased after participating in the FAM program, but we noticed those results regardless of previous participation and regardless of location. So that was encouraging as well. And finally, there's clearly a need for funding to support more asthma management education. When we looked at the data and the numbers of students who had participated in any sort of asthma education programs before ours, it came out to be 14% of students had said that they had received asthma education in the past. So, you know, out of all of those students, that's a very small percentage, and we were really encouraged that we could go in and for some students, be that first time that they were exposed to that education. So there's obviously more work to be done, and we were able to reach a good number of students who needed this education, but there's always room to continue supporting this. And then just to acknowledge Illinois State Board of Education, who provided us this grant, as well as the team at UCM who helped us with this data analysis. And that's all I have.
Since we are a relatively small group, if attendees have questions, if you feel more comfortable putting them in the chat, go right ahead and I'll read them. Or if you'd like to unmute your microphone and go on camera, you're welcome to just ask any questions you have to the group. Thank you so much to Mary for sharing that great work with us. I have one question while folks are getting their thoughts together, maybe. I don't know if this is more for the CPS group or more for Mary, but both of your presentations made me think of this. Have either of your organizations done anything with the law that was passed a few years ago about stocking asthma medication in schools like they do for EpiPens?
Yeah, we over at RHA, we were involved in that, and it's something that's still continuing to be implemented in schools. But yeah, that was passed last year, I believe, and I think right now, you know, things were a little tricky with students not getting back into school. But yeah, we are still working on that, and hopefully gearing schools up to get those prescriptions in, and having that stock asthma medication every school, hopefully.
Awesome.
Victoria, I do not know the answer to that question outside the scope of my work, but I could connect you with Justine if you aren't already connected. I'm sure she'd have an answer for you on the status of CPS.
Perfect. Thank you so much. Just curious.
I just wanted, this is Leslie from RHA. I'm with Mary. I just also wanted to mention that we worked with IDPH to create a stock albuterol toolkit that we have available for schools to use as well. And have been working with schools to figure out there have been some barriers to how schools get the prescriptions for that. There's been some pushback from pharmacists on it doesn't have a name on it. If it's you know, so we're working with schools to figure out how to get a standing order and hopefully getting some information out from the Illinois Pharmacists Association or some, I can't remember their exact name, you know, encouraging them that using a standing order is acceptable under their rules. So I'm still working out some kinks with that.